What's up, everybody? We're going to go over a full body mobility routine that you can perform at home, and then we're going to get into some certain aspects of functional range conditioning that imply that will What's up, everybody? I'm Dr. Jordan Weber, and we're going to go over a full body mobility routine with you today. You're going to start in the kneeling position or the half kneeling position. So you can be like this, you can be like this, or you can progress and just sit down on the heels. So you'll be able to decide what works best for you. And while we're in this position, if you aren't able to get into any of those positions, you can stand up and try these same exercises standing. All right, so choose your position, either standing, half kneeling, kneeling, or collapse kneeling. Okay, so I'm going to go into the collapse kneeling version this entire time. Why I chose that is because I'm naturally intensifying my legs, which means that they're going to be more static. When I go like this, there's going to be more room for me to move. And so what I'm really trying to do is control my range. So standing, obviously, you might be swaying side to side. Half kneeling right here is another way you can do it. You get a little bit more stability, a little bit less stability, and then more stability, but this is harder on the knees. Okay, so choose what you want to do today. We're going to sit up nice and tall, squeeze the fists wherever you are, same cues. Breathe. From here, we're going to squeeze the fists, irradiate from the inside all the way to the outside, so all of our limbs, our entire body is irradiated except for the joint that we're moving. So what we're going to do is we're going to pretend that we're moving through sludge or very thick water, okay? So maybe like oil. And what we're doing is we're slowly finding our range of motion in that circle without using any other joint coupling. So for example, if I were to laterally bend here and my shoulder and my scapula were to elevate, then I would know that I have some type of issue here. So if I'm able to go through a full range of motion without moving anything, I know I'm not recruiting or compensating in any type of way. So the better our joints work, the better we're able to have joint independence, and we'll have joint interdependence. So let's go ahead and get started. Sit up nice and tall, squeeze the fist, irradiate from the body. Inhale, pack the air low, flex the head down, rotate, bend to the side, extend back, bend to the other side, rotate, flex down, one more circle, go take your time. Try to go as slow as me. If you're going too fast, you're not sending any information and you're not going to be able to build any information in that area. Let's go the other way. Neutral to start, flex down, rotate, bend, extend back, rotate and bend the other side, flex down, one more rotation. Good. From here, we'll get our thoracic spine. We're going to cross the hands across the chest. Now you can do this kneeling if that's hurting the knees, or you can do this standing, or you can also do this half kneeling, whatever works best for you. From here, we're going to flex down, rotate, dip the shoulder to the hip, extend back, dip the hip down, flex around, one more circle, laterally bend, extend, laterally bend, rotate, flex forward, and start at neutral, flex down, rotate, bend, extend, bend, rotate, flex down, one more, nice and controlled, super slow. Good. From here we'll get our scapula. Bring those hands out. Again, if this is too much for the knees, you can regress by doing this, or you can stand. From here, hands in front of the shoulders, out about 10 degrees, squeeze the fists, and then wrap one arm across the body. From here, one arm at a time, we're going to go through a full circle of the scapula, reaching forward, elevating, retracting, depressing, protraction here. So try that with me. Squeeze the fist, keep the elbows straight. We're going to start with retraction, elevation, protraction, depression, retraction, elevation, protraction, depression, other way, protraction, elevation, retraction, depression, protraction, elevation, retraction, depression. Other side, protraction, elevation, retraction, depression, protraction, elevation, retraction, depression, protraction, elevation. Let's go the other way. Depression, retraction, elevation, protraction, depression, retraction, up, forward, and around. One more time. Good. All right. From here, you can sit up. We'll get our elbows and wrists before we get our glenohumeral joint. We're going to supinate the elbow, and we're going to bend the elbow, pronate, extend, supinate, bend, pronate, extend. We'll do a couple more. Keep those biceps and triceps squeezed as much as you can. Radiate, bend, pronate, extend, supinate, bend, and then we're going to go extend, pronate, bend, supinate, extend, pronate, and bend. From here, just the wrists, hands in front, extend the wrists, in and down, in and up, up, all the way up, up, up and out, all the way out and around, down, down and in, squeeze everything here, whole body's radiating, go super slow, find your outermost circle till you repeat to the center. Let's go the other way, out and up, control it, in. It's easy to get lazy here, try not to get lazy, squeeze everything all the way down, trying to find your outermost range, out, out, out and up, all the way up, try not to bend those fingers, all the way in, all the way down, nice and slow. For the glenohumeral joint, half kneeling, collapse kneeling, or standing, we're going to squeeze both fists. From here, I'm going to go into shoulder flexion without using any other joints like my back or my scapula. So just the shoulder flexion here. From here, I'm going to squeeze the biceps inward, internally rotating at the shoulder as much as you can. And then we're going to go into extension and abduction here. Keep internally rotating, freeze. From here, make sure that you're not using too much scapula. Internally rotate, reach back as far as you can. Try to create a big circle here, all the way back. Keep internally rotating all the way until you get to the side of the body, half of rep 1. From here, extension. We're going to unwrap into external rotation of the shoulder. Try not to move anything else like the neck or back. As you reach back, keep externally rotating. And then from here, all the way to flexion, we're going to go to adduction across the body and down. We'll go up across the body, adduction for rep 2, all the way to flexion, internal rotation, all the way to extension. Everything's irradiated. Don't move anything but the shoulder. Keep internally rotating. Expand that circle all the way down next to the side of the body. Half of rep 2. Here we go. Extension, unwrap, external rotation. Move at the bicep, not the forearm. Reach back. Prepare for flexion and adduction all the way down. All right. Other side. Give you a different angle. Flexion. Head's in line with the spine. Chin's in line with the sternum and navel. Squeeze the fists. Bicep turns inward. Shoulder goes to external rotation or internal rotation. Reach back. Keep internally rotating. As you're in extension, try not to elevate the scapula. Keep internally rotating half of rep 1. Extension, try not to elevate the scapula, try not to flex the neck. Unwrap, externally rotate. Flexion, prepare for adduction across the body and down next to the side. One more. Adduction, flexion. Internal rotation at the shoulder. Reach back. Keep internally rotating. Try not to flex the wrist or elevate the scapula. Internally rotate, half of rep 2. Extension, unwrap to external rotation. All the way to flexion, across the body, forward and down. That's the glenohumeral joint. From here, we'll get our full spine. We'll start in cat. Around the back, tuck the chin, hands flat here, all 10 fingers pushing into the ground, knees in line with the hands and the feet. Tuck the chin, tuck the pelvis under, hold and breathe here. Use your upper back, mid back and low back, hands and toes to push into the ground, really using all the posterior tissue to push into the ground. Push the ground forward with the hands. Push the ground back with the knees and the feet, trying to separate the ground. Hold here at 10% effort, 20%, 30, 40, using all the posterior tissue, upper back, mid back, low back, glutes, feet, knees, pushing the ground apart, 50%, 60, 70, 80, 90, all the way to 100% and hold for 10 seconds. Keep your intensity high after that 10 seconds. 5 more seconds, keep going as much as you can, pull the ground apart. And then from here, we're gonna try to pinch the ground with the abs and chest. Don't move positions, keep your back rounded, keep your chin tucked, keep your pelvis tucked. Use your abs and chest to pinch the ground. Keep going, pinch, 100% intensity. Use the abs, use the chest, pinch the ground. Keep going, 5 seconds. 4, 3, 2, and then from here, slowly pull into the ground. 1 vertebrae starting with the lowest part of the spinal cord to the low middle, to the middle, to the upper middle, all the way to the upper thoracic spine, mid-thoracic to upper thoracic, all the way to your cervical, head and neck. Hold here. Retract the scapula. From here, we're going to pinch the ground with the abs and chest. Pinch the ground, 10%. All the anterior tissue here, 20%. Squeezing the ground, pinching it, trying to bring the knees to the hands, hands to the knees, feet to the knees. Squeeze the ground, 30%. Keep the integrity of the spine. Keep going, 40%. Head is up. Anterior pelvic tilt, all the way to 60%. Use the abs and chest. All the anterior tissues, all the way to 70 to 80. All the way to 100% intensity and hold. 10 seconds. Hold that intensity high after those 10 seconds. 5, 4, pinch the ground, 3, 2. Now with the back, push the ground apart. Keep the integrity of the spine the same, shouldn't move. Using the back, using the upper back, using the spine to pull the ground apart. Pull the ground apart. Trying to push the ground apart. Push forward with the hands, using the upper back. Push back with the knees and the feet, using the back. Keep the back arched. And then from here, head and neck flex down. Upper back goes toward the sky, mid back, all the way to low back. Relax back into cat. Good. From here, we'll get the hips. We'll get them in the hands and knees position. From here, we're going to keep everything nice and still this time, so nothing moves but the hips. So we shouldn't be arching our back or anything like that. You can put a yoga block on your back to make sure that you're balancing right. So from here, we're gonna bring the knee toward the elbow, abduct the hip, internally rotate as you extend, and then flex forward. Out, in and back. Keep that heel high, keep that elbow bent. Now we're gonna go the other way. From here, keep the knee bent, go to hip extension, external rotation, abduction, flexion, forward and down, and then back, out, all the way forward. Try not to move anything but the hip. Okay, other side. Push into the ground, intensify the irradiation here. Keep the body still but the hip, abduction, internal rotation to extension, forward, out, internal rotation to extension, and down. Now we'll go the other way. Extension of the hip, external abduction, forward and down. Back one more time, extension, out, forward, and down, and then there's our hip. For our knee, we're gonna go ahead and hold on to the hamstring, straighten one leg out in front of us. From here, we're gonna externally rotate the foot, turn the foot out, pull that knee up toward the chest, push that opposite heel down, extend here, in, flex, trying to break that forearm, out, up, in, down, out, up, in, down. Now we're gonna go in and up, out, down, in, up, out, down, in, up, out, down. And then from here, the ankle, plantar flex, push down, in and then up, 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 up and out, out, out and down, down, down and in and up, up and out, out, out and around and down, other way, down and out and up, up and in and down, all the way down, all the way out, all the way around, up, forward and down. We'll switch sides, other knee, underneath, grab, turn the foot out, pull it all the way up to the chest, extend the knee, internally rotate, flex down, out, up, in, down, out, up, in, down, keep it in, up, out, down, in, up, out, down, in, up, out, down, ankle, point the foot down, press the opposite heel down, in and up, 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 up and out, out, out and down, down and in and up, up, up and out, out, out and down, other way, down and out, all the way up and in and down, down, down and in and and up, up, up and in and down. Now we're gonna get our patella, the movable bone right on our knee. We're going to make sure the leg is relaxed. It's the only controlled articular rotation that we do that we are relaxed. So we're just gonna push that kneecap in a 360-degree circle, starting at 12, going to 3, 6, 9, 12, and just following that rotation about 3 times one way and then 3 times the other way. Now if you feel clicking but there's no pain, that's probably not an issue. But if there is clicking and there is pain, then that's something you want to take note of. You should be able to move that patella in a 360-degree fashion. Now if you can't move it in a certain area, you're going to have a knee lock, which is going to put you at more risk at different injuries. So making sure that you have full mobility of that patella and that you're able to passively push it around. Now if you do have issues in the patella, I was advised to push into that area and hold it, for 10, 20, 30 seconds, just getting that area used to movement, getting that area full of blood, and getting that area prepared to move again. So we don't want to delay that movement, so we want to get as many active inputs as we can. All right, now for the feet, you can do this standing. From here, all 10 toes up off the ground. Then from here, just the big toe stays up. Hold here, 5, 4, 3, 2, switch, big toe down, small toes up, hold it here. Try to separate those small toes, hold it, 5, 4, 3, 2, and switch, big toe up, small toes down. Really try to get that big toe up. If you see it going outward, sometimes you might want to redirect it a little bit, try to get it in this direction eventually. And then switch, big toe down, small toes up, hold here. Now from here, all toes up. Now from the pinky all the way to the big toe down. One more time, pinky, big toe down, and then from here, all toes up. Just the big toe touches the ground 3 times, 2 and 3. And then there's your toes, your knees, your kneecaps, your hips, your back, your shoulders, your neck, and scapula, glenohumeral joint. Now that was your full body CARs that you should perform each and every single day. As soon as you wake up, as soon as you get the chance, begin to start rotating your joints in their full range of motion. See where your body is at. Every day you're gonna get 1% better. If you do it through the course of 365 days, you're gonna have so much more control of those ranges that you may have not even known of before this video or before being informed that if you don't take your joints through their full range of motion, you're gonna lose those active abilities or capabilities. So making sure that you do that kind of stuff 10 minutes a day, doesn't take that long. It's something that anyone can do really to their full capacity as long as it is prescribed by FRC specialists or somebody who's aware of body practices. All right, thanks a lot. And now we're gonna get into more full body stuff.